When I applied for PhD funding 4 years ago, I wrote that my project was important to help understand how to rapidly scale up a country's ability to care for severely ill patients in the event of a large outbreak of an infectious disease. I didn't anticipate that I would be recording this from my hotel bedroom in Armenia, where I've been deployed by the UK government to help support the care of critically ill COVID patients using what I've learned during my PhD. The question I set out to answer was, how can we support nurses and doctors to provide the best possible care to the sickest patients in settings without large numbers of highly trained staff and lots of fancy equipment? How can we train hospital staff to do basic life-saving things as well as possible? To answer this question, I use the science of behaviour change. This uses an understanding of human behaviour to design ways to change how people behave. The first stage of my project was to understand more about those behaviours I wanted to change. To do this, I spent a whole year just watching what was going on in 3 intensive care units in Laos. I'll give you an example of what I learned. When you put a poorly patient onto a ventilator to support their breathing, it's a risky time. You need to prepare all the right equipment in advance to make it safe. When I watched what tended to happen, not all the equipment would get prepared beforehand, and some bits got forgotten entirely. So, during the second stage of the project, I set out to try and change this. Behaviour change science suggests that we can change the environment to make it easier to do the right thing. So when my team taught about how to put patients on the ventilator, we also provided a special mat with photographs of all of the right equipment as a reminder. We put this mat on top of the equipment trolley in each ward. The final stage of the project was to check if all of this had actually managed to improve the care that patients were receiving. I found that some of our changes worked better than others. In particular, we found that simple prompts, like the equipment mat, could really support people to provide safer patient care. It's these successes that we were able to scale up rapidly during the COVID outbreak. At the request of the Lao government, I rolled out an abbreviated version of my PhD training around the whole country. This mat is now in every intensive care unit in Laos. Tomorrow morning, I'll be using the same principles to support my Armenian colleagues. However, I've decided that next time I write a grant application, I'm going to be a bit more careful about predicting any more global pandemics. Thank you.